is sponsored by The Good Feet Store. The life you love starts here.
Summer is a fun time of the year, but it's also a time where summer ailments become all too common. Well, Dr. Shelton with Tryon Medical Partners says you need an emergency kit on hand to take care of those pesky summer health problems. We welcome him to the show. Hello, sir. How you doing?
I'm doing well, Eugene. Good to see you again.
Just talk about summer. It's fun time, but it's also a time that you got to be very, very careful. Is that correct?
Absolutely. So it's great to be able to be out and about with a lot more freedom right now, but we have to be careful of lots of different things in the summer, things that can really sneak up on us and slow us down a bit if we're not careful.
Well, let's talk about one of those things that can sneak up and slow you down. You say bug bites. Be aware of bug bites.
Yeah, so that sounds simple, but they can be really itchy and annoying, and some people get allergic reactions after having a bite. So the best thing is to try to prevent that. So think about when you're outside, try to be somewhere that's breezy. You can use bug repellent. If you are bitten and they start getting itchy, I would definitely take some oral Benadryl. It's an antihistamine, so it helps kind of turn down your body's itching response. And then topically, you can use some hydrocortisone cream, which is also a steroid that kind of blunts the itching and the reaction that's happening there locally on the skin.
That is some great advice. Let's talk about this one. I always hear leaves of three, let them be, and I'm talking about poison ivy.
Yeah, so this is a common one. We're outside doing yard work. We don't realize we've gotten into poison ivy, and some people are super allergic to that. It's actually not the leaf technically that we're allergic to. It's an oil or a resin that's on the leaf. So it's when we come into contact with that oil, our skin can react. It can give us kind of red bumps. Sometimes it'll look like a linear streak, basically where the plant or its oil has rubbed against our skin. So it's common on hands, forearms, lower legs if we're wearing shorts. So it can be a real doozy. So the hydrocortisone cream actually will really help to turn down the itching, and you could still use Benadryl orally as well for that type of allergic rash.
What other rashes do you use if you're not using some of the other remedies that you just mentioned when you're talking about rashes?
Well, it depends on the cause. There are some common summer things that are totally benign that don't give a lot of symptoms. You don't really need to do anything. If it is a fungus, then the treatment is different, or a yeast, the treatment is different. So it really depends on the cause. But I would always keep hydrocortisone with you because that's going to turn down the itching response to most things.
All right, and then lastly, sunburning. I'm telling you, you got to make sure you take care of your skin in the sun because it can be brutal.
Absolutely. This one can get dangerous, so it's best to prevent the sunburn. That's really important. So try to put on your sunscreen or sunblock at least 15 to 30 minutes before you even go outside, and use whichever one that you will actually use and reapply. It's better to put on a full layer before you go out and let that have time to kind of soak in. If it's a spray that you're using, you also need to rub that in. I think some people just skip that step, and so you're more likely to miss spots. So I would prefer to do kind of a base layer with a topical sunscreen that you rub on, and then you could reapply later on. But if you do have a sunburn, we want to try to cool the skin. So you can do a cool compress or grab a frozen bag of vegetables out of the freezer and kind of put that on your skin to cool it, cool water, cool bath. And you could also take NSAIDs, which are anti-inflammatory medications that will help kind of turn down your symptoms of the discomfort from it. So that's like naproxen, which is Aleve, or Motrin, Advil, which is ibuprofen. So those I would keep with you just in case of a bad sunburn. You can also do topically some aloe, which can help as well.
So Dr. Ryan, you mentioned a whole bunch of things that we can use. What is some things that I should keep in my toolkit to go ahead to mitigate against some of those issues?
Yeah, so I think if we're traveling or even at home, we need to always have some oral Benadryl, which is the antihistamine that will help turn down itching, topical hydrocortisone, which is the steroid that will help to offset some of the discomfort and itching from different rashes. Definitely pack your sunscreen, and I would buy that ahead of time so that you're not struggling to find something and you can really get the one that you want, it needs to be SPF at least 30 or maybe higher, but you have to remember to reapply. But I think if you can have the Benadryl and the hydrocortisone and your sunscreen with you, I think you will be ahead of the curve.
Well, Dr. Ryan Shelton with Tryon Medical Partners, thank you very, very much, sir.
Absolutely.